So the idea is just to read the article about focal cortical dysplasia from Radiopedia. So let's start. So focal cortical dysplasia, start Radiopedia and say, abbreviation is FCD, represent a heterogeneous group of disorder of cortical formation which may demonstrate both architectural and proliferative features. They are one of the most common causes of epilepsy and can be associated with hippocampal sclerosis and cortical glycerneural neoplasm. So, it will start with epidemiology, then clinical presentation, then pathology, then radiographic features and treatment, differential, and that's it. So, let's start with the epidemiology. So, and if you can see images, so there will be images, but if you can't, so can. Epidemiology. Age of presentation, usually with epilepsy, in part, depends on the type of cortical dysplasia, with type 1 more frequently presenting in adulthood. Clinical presentation of focal cortical dysplasia is a frequent cause of drug refractory epilepsy. So it's drug refractory, it causes drug refractory epilepsy. Pathology classification. Since the first description in 1971 by Taylor et al., a number of classification systems for focal cortical dysplasia have been devised. These include a previously commonly used classification used by histopathology proposed by Palmini et al. in 2004 and a genetic imaging classification by Barkovich et al. in 2005. The consensus classification published by the International League Against Epilepsy Diagnostic Method Commission, lead author Blumke, has incorporated and largely suppressed other classification systems. Unfortunately, as is the case with many classification systems that have developed in parallel with numerous iterations and revisions, there is significantly overlap between the various per classification systems with the same terminology used slightly differently. As such, it is safest to explicitly state which classification system is being used. For example, Bloomkey type 2B. So it tells us which classification system there are. Taylor dysplasia, Palmini classification of focal cortical dysplasia, Barkovich classification of focal cortical dysplasia, and ILAE Bloomkey classification of focal cortical dysplasia, which seems to be the most recent one. Radiology features. MRI. MRI is the modality of choice to assess patients with possible focal cortical dysplasia, although not all histopathological proven areas of focal cortical dysplasia will be evident on MRI, and at other times, focal cortical dysplasia will be found adjacent to other lesions, e.g. tumors. General features of focal cortical dysplasia include cortical thickening, blurring of gray matter junction with abnormal architecture of subcortical layer. T2 flare signal hyperintensity of white matter with or without transmantle sign. T2 flare signal hyperintensity of gray matter. Abnormal sulcus or gyral pattern. Segmental and or lobar hypoplasia atrophy. There is no edema classification of or contrast enhancement. Also, each type of focal cortical dysplasia can exhibit more or less of these features. The types below refer to ILAE Bloomkey classification of focal cortical dysplasia. So, type 1, generally not obvious on MRI, may see subtle gray-white matter junction blurring due to neurons located in the subcortical U fibers. The majority involve the temporal lobe. Type 2A, blurring of gray-white matter junction. Junction. Cortical thickening. Abnormal gyrosulcal pattern. Type 2B, Same is type 2A with the addition of focal signal abnormality in CRIST2, extending from cortex to vertical, transmental sign, seen in 94% of cases. Type 3. Type 3 focal cortical dysplasia, according to ILAE Bloomke classification, is focal cortical dysplasia associated with adjacent other abnormalities, e.g., 3A hippocampal atrophy, 3B tumor, e.g., DNET or ganglioma, 3C vascular malformation, 3D early childhood insult, e.g., gliosis, and as such, imaging appearance will be dominated by the associated abnormality rather than the dysplasia itself. Treatment and prognosis. Surgical resection of the refractory epileptogenic area of focal cortical dysplasia typically leads to good seizure control. In the presence of transmental sign, better post-surgical outcomes have been reported. Differential diagnosis: adult-type diffuse glioma, which can be from astrocytoma, oligodendroglioma, and glioblastoma. Glioneural and neuronal tumors, ganglioma, and dysembryoplastic neuroepithelial tumor, DNET. Cortical hamartomas of tuberous sclerosis. So this was about focal cortical dysplasia from Radiopedia. We just read throughout it. It was quite short. Thank you very much. Thanks for Radiopedia. That's it.